I just kind of went into the fight or flight mode, and I knew I couldn't fly. I had to fight.
And we can understand each other because we have an understanding that it's the same thing what we're going through.
I don't really care if I have to come here because they take really good care of me.
Hope, compassion, companionship, care, combined with the finest medical care, medical technology, and medical know-how. The Showers Family Center for Childhood Cancer and Blood Disorders at Akron Children's Hospital in Akron, Ohio, offers a comprehensive clinical treatment for children with all types of cancer and blood disorders. More importantly, the treatment doesn't stop with the medical intervention. It continues at school, work, and home.
Happy birthday to you. Happy birthday to you.
Even though I was a lot older than a lot of the patients at Children's when I was diagnosed, they've accommodated me through my teens and into my early 20s. They have supported me through high school, and now I'm a college graduate, and they supported me all through those 4 years and continuing support after I've graduated and into my adulthood.
Everybody up here is really awesome, from the nurses to the doctors to the cleaning staff. They're all so nice, and they make you really feel like this is a temporary home, I guess. But I mean, they've all been so great.
The motivation that I think all the staff have here to get up and do their job every day is the energy that we get back from the kids.
Dr. Jeffrey Horde is director of the Hematology Oncology Department at Akron Children's Hospital. With help from the community, Dr. Horde has overseen an evolution in the care of patients with all types of cancer and blood disorders. The young patients are treated with leading-edge methods and technologies, but in equal measure, patients are taught how to live life with debilitating disease.
We have a group of folks here from our nurse clinicians, our nurse educators, our psychologists, our social workers, our child life therapists, all of which play an important role during those early hours and days to help everybody come to adjust to this news, which will forever change their lives.
I wanted to work in a profession in which I had long-term relationships with my patients and families so that I could get to know them as people, spend a long time with them, be part of their lives, be part of their families, literally.
But we're not going to live on stats. We're not going to live on percentages. We are going to live on what now, not what if. So, just being here, they treat us like we are their family, and we couldn't get through this without the nurses, the child life specialist.
Akron Children's Hospital Inpatient Cancer and Blood Disorders Unit has 20 private rooms. Each room has a sleeper sofa so a parent can be with the child at all times. Each room also has a video game console. The unit has 2 activity rooms, one for small children, the other for teens, complete with pool table, television, movies, and computer. The entire unit also has a HEPA air filtration system to provide extra protection against the spread of infection. Highly specialized teams take special care of the children.
Within the Showers Family Center, we have several programs. We have our sickle cell program, we have our hemostasis and thrombosis program, we have our stem cell transplantation program, and of course we see patients with a full range of problems related to blood disorders and a variety of cancers.
I think that we are large enough and broad enough to serve the vast majority of needs of patients with hematologic and oncologic problems. There is very little that we can't take care of here.
Akron Children's Hospital Outpatient Cancer and Blood Disorder Clinic has 12 treatment and exam rooms. Those rooms are used for patients who require regular intravenous infusion treatments. Among those, chemotherapy, antibiotics, and blood products.
Everybody, let's release our balloons. Thank you very much.
The treatment goes on outside of the center, onto even a baseball field for Survivors Day, an annual event for present and childhood cancer patients. They join together for support and celebration one day each year.
The long-term follow-up clinic that we run involves caring for children who are done with the active treatment for their cancer, but who must now go on to live full, productive lives in society. And what we try to do is to prepare them as human beings, not just as cancer survivors.
The hope for the future, I'm not sure if it'll be in my lifetime or not, but my hope is that we will gradually and as fast as possible move toward a time when we are able to cure every child that walks in the door of our facility. And we're a whole lot closer now than we were just a few years ago. But that's the ultimate goal, is that every child that we treat will have a curable illness.
And now they're helping me a lot with late effects, what's happening in my life and to my body after chemotherapy. And it's kind of a new endeavor with a lot of childhood cancer survivors now, so they're really helping me transition after having cancer and living with cancer into life after cancer.
I feel pretty much back to normal. I mean, it's been such a long time, I can't really remember what normal feels like, but as far as, all that goes, I'm feeling fine. I'm feeling really good.
My mom's thankful for this place because they take really good care of me.